Hello guys. This is Rochelle Insurance Girl, live and on location, and so very excited to have a very special guest today. Sorry about the outside noise. We are here live, and if you guys have been here, you know that the traffic is kind of loud coming by sometimes. But welcome, Julian Riley with We Care. Julian is a multi-passionate entrepreneur. Thank you for coming today.
Thank you so much for having me. I appreciate it.
He's also one of my co-authors for the Top 25 Changemakers. So I'm so excited to have him here to talk to you about one of his major passions, and that is going to be his nonprofit, We Care, and it is such a unique and powerful organization. This is a new nonprofit, and I'm really excited to share this because, as you guys know, it's so close to my heart. Whatever we can do to help control the financial devastation of healthcare spending.
For sure.
Just the number one reason for bankruptcy, and I know you're serving this community on such another level. So tell us more about it, Julian.
So, We Care, like I said, it's We Care LF Inc., right? So the LF stands for Like Family. So we try to care about you like family. And one of the things that we specialize in is we have a 340B program. Our 340B program gives a discount on prescription drugs. As you know, you're the insurance girl, so yes, prescription drug costs, it's crazy. Just, and these pharmaceutical companies are making trillions of dollars. So in 1992, the government actually, wanted to kind of circumvent that a little bit. So what they did was they gave for licensed health centers or health facilities that qualify for the 340B program, you get it's kind of like a rebate, savings rebate for your customers. So you're able to get charge the insurance companies a little bit less for the prescription drug costs, and then the pharmaceutical company gives you a rebate, and with those savings, we're actually able to provide programs to the community. So some of the programs that we have,
So just to back up, this is just to be clear, I want to make sure people understand, because I talk a lot about programs like GoodRx and some of these discount prescription programs. This is really next level. I look up prescription costs all the time on GoodRx, and the numbers you were telling me about, you're able to save people out of pocket costs is just exponential in comparison to that type of program.
Yeah, so we save anywhere between 40 to 75% off their prescription drug costs, right? And then we get, like I said, we'll get those subsidies as a kickback to us, and then, like I said, we're able to provide programs. That's actually one of the requirements. So we have to, give back to the community. So it's just a really good way that Uncle Sam does kind of take care of you in that way, because they're, making these drug companies, which are making so much money, kind of have to, do something to give back to make sure that drug costs and things like that are affordable for people, because the rise in healthcare, people are living longer lives, and the older you get, a lot of times the more medications. Unfortunately, we've been coached to have bad diets and different things like that. So we get older, a lot of people have high blood pressure or diabetic or, are on dialysis.
And
like these.
Those are some of the medications. You mentioned diabetes. Insulin is one of those things that absolutely breaks the bank for so many families.
Yeah, I literally had a client yesterday. I was able to save them their drug costs. I think that it was $1,600 for the insulin pen that they needed, and I was able to essentially get it for around like $450. So like that's huge. That's a game changer. That's a really, really big savings. And then because we offer copay assistance, they were paying $225 a month for their copay for that one drug in particular. And with that, now we get to, I think that's over $2,400 a year in savings.
Next level. It really is, because where other programs might be able to get a period of time where there's a discount or a coupon to come in and help them with the copay.
Yes.
Because $200, $300, $400 can absolutely be just off the table for a lot of families.
For sure.
People on fixed income.
Honestly, and he was on the client was on a fixed income, and his daughter was the person that called me, and he was actually thinking about not taking it, and she was like, "Dad, you can't not take it because you could pass away if you don't get this." So
we see it all the time. People are avoiding any kind of medical care because they can't afford.
Money. Yeah. And that's so crazy.
Such a broken system, unfortunately.
It is, but like I said, we, thank God that, we have programs like ours and people like you to raise awareness of that, and, us to be the champions on really changing the narrative on that and really doing the work to help the people and help the community.
I just love this model because the way you're able to give back is really with impact. You mentioned the prescription assistance.
Yes.
And then there's also even phone
Yeah.
service.
Oh,
Tell
yeah.
me about that.
Yeah. So we partner with a company, and we're actually able to, anybody can take advantage of it, but it's really to service like a lot of low income people.
Sure.
But we give them like a little cheap smartphone, but it's an Alcatel phone, but we really want to do that because we do telemed services. So a lot of times the clients that we service, if they're in the VA or they're BOLI or they're, or just low income, they might have a little flip phone, or sometimes they'll have a phone, but their phone doesn't work. A lot of times we get clients to where we get their information, but then we can't follow up with them because their phone line's off. Now they get a phone line. It covers talk, text, and they have a limited data plan, but we, essentially cover, those services for them, so they'll always be able to at least have a number. They'll be able to have consistent, if they have a family or anything like that that's trying to reach them, they don't have to worry about their number or anything like that changing.
It's for their health.
It's for their health.
best interest.
Exactly.
Yeah.
Yes.
It really does serve, and it helps them access that care, like you said, through telemedicine.
Yes, ma'am. Yes,
Such
ma'am.
a huge game changer telemedicine has been. Come forward just a bit.
Oh, okay. Yes.
Because, there's so many barriers to mental health. Anyway, so many barriers. I'm advocating for some individuals that don't have coverage, or they're on Social Security or Medicaid, or veterans. You mentioned veterans,
Yes.
and I know that you're serving that community as well.
We are.
But tell us a little bit how you're able to help those individuals that are just struggling to even get care for mental health. And it is a national crisis right now.
It's a national crisis. So one of my team members, Mr. Ike Thomas, right? He's been a social worker for the last probably like 25 years in this area. So he has a really good relationship with all of the mental hospitals in this area. And one of the pushbacks that he was getting was that, they were like, man, we just need a psychiatrist, because a lot of the times when they get admitted to the hospital, they get admitted, and then but it's more so kind of like an emergency.
Yeah.
So they're not able to get treated.
It's like symptomatic.
Yes, it's symptomatic or situational.
Yeah.
And then when they leave, they aren't able to get their prescriptions filled. And then because it's such a in high demand, the psychiatrists and things like that, they're so overworked to where they don't have to necessarily see people, or if the insurance is faulty or different things like that. So we partnered with a psychiatrist, and so we now are able to actually, we'll have a nurse practitioners that's actually going to be treating people 3 days a week at our location in Tampa. And they're going to be able to help prescribe different medications, and people will be able to get telemed treatments, and we'll really be able to service mental health for that community, because I think everyone now is suffering through like depression, especially with the pandemic and everything like that. It's a lot of just things going on. So I'm super excited about being able to do that.
So where is that location? Tell the viewers, where can they find you in Tampa?
Okay, in Tampa, you could actually find us on Martin Luther King. We're literally right down the street from St. Joe's Hospital. If I looked at my phone, I could get you probably the exact address.
Okay, we'll circle back.
We'll circle back around to that. And then we also have another a facility, a pharmacy in Brandon, Florida, called My Pharmacy of Brandon. So in our location in Tampa, where we'll be doing treatments, and it's also a pharmacy, is actually called Midtown Pharmacy. So you could also Google the name. But like I said, when we circle back around, I could get the exact address.
Nice.
Yes.
Such like I said, such an impact on the community, and really filling so many voids in the community. One other thing that you were going to tell us about was the HIV awareness and the programs. And this new mobile unit that you're getting. Tell me all about it.
Yes,
I'm so excited.
Yes, I'm so excited. So we just purchased a mobile unit. We'll be able to order labs, actually do labs and testing for people. So I'm really, really excited about that. We essentially can go around the whole state. I know Quincy, Florida, up there by Tallahassee, that's very, very, very underserved. A very, very underserved community, and so we're going to make an initiative in August and September to really go see them. I was on the phone this past week with the mayor of Belgrade, actually, in Belgrade, like the Palm Beach County, Belgrade, Immokalee, Pahokee, that area, they call it the muck. But they have a very high concentration of people that struggle with HIV. So just there's a lot of just drug houses. There's a lot of poverty and things like that. So it's just a lot of human, and it's a lot of human trafficking. They have a lot of migrant workers and things like that. Some people that that are illegals and things like that. But of course, with the new laws that were passed, a lot of those people now can get health coverage, and then so now we're able to be here to help treat those people, so we can help save lives.
Thank goodness.
Yeah.
It's just crazy this time, and there's so many resources. First of all, people don't even know about these resources. That's why we're here. We want to bring awareness to this. This is such a service that so many people can benefit from. People that are suffering, mental health, also just the awareness of the HIV.
Oh yeah. I'm glad you touched back on that. This
needs to be a conversation. We need to bring this conversation to the forefront because the numbers have been rapidly rising. We're not hearing about that on the news, are we?
No.
We're not hearing about that in mainstream media. But this is, these are the things that are impacting our communities, and there's such a trickle effect when it comes to so many of these poverty communities too, right?
For sure,
they're really
for sure.
vulnerable.
They're very, very vulnerable. And then even just, because of just practices and things like that and reckless behavior that has just gone on for years, the Tampa Bay area is, I think we're like the second rising in the country for like new HIV cases, so we definitely need to be aware of it in this area. So we actually have things set up in place. We offer benefits for people that struggle with or that want to just do preventative care. So people that are on PrEP and Truvada and Descovy, we have a resource card that actually anyone that uses our pharmacy has access to this resource card. We do between $25 to $50 a month, and then if you're actually positive, we will actually link you with your own individual social worker. Well, you definitely will be able to get linked to our psychiatrist, because we understand that may be, hard to deal with. And then we also have a housing stipend, guys. This is big. We have a housing stipend up to $1,000 a month that a person that is positive can actually get. So we want to raise as much awareness to that as possible, because we know that can help. We know that even with the copay assistance, people are paying $200, $300, sometimes $400, $500 a month if they're positive, for prescription drugs, and you have to do that because
they're doing without those meds that they need.
Exactly.
To live or to keep their families safe, to keep their partners safe too.
Exactly.
Yeah. So we've got to get the word out. So share this post, you guys.
Please do.
Share the awareness, and you can reach Julian on Instagram, on Facebook, under Julian Riley.
Under Julian Riley, yes.
And I understand we're working on some websites and some materials that we'll be able to share with you guys about all the awesome resources.
Yeah. I have a landing page now. You can definitely get all the information on that page. It's wecarelfinc.org. But like I said, we have a Facebook page. It's We Care LF Inc. And then, of course, you can find me at Julian Riley on Facebook and Instagram.
Excellent.
Yes.
So while he's looking for the address for the Tampa, just be sure to go and follow him. We Care, was it LF Inc.?
Yes.
Okay. We Care like Family Inc.
Yes.
It's amazing. And this guy has a lot of amazing stories to share, some great inspiration. He's an entrepreneur. He is a professional trader. He is a teacher of trading, and really focused on helping people take control of their financial future. As you guys know, that's a big part of my platform. We have to make sure we're connecting our health and our wealth, and really taking control of those dollars that are going to protect us in the time of crisis. So I'm just so blessed and so honored to have Julian here today. That I'll put the link to the Facebook page and to the website there in the thread to this live. But again, be sure to reach out to this guy, follow him, check out what he's doing for the community and what you might be able to do to help him raise awareness. So where can we find you?
Okay, we at our Midtown pharmacy location, it is 2136 West Dr. Martin Luther King Jr. Boulevard. That's Tampa, Florida, 33607. Some of the treatments and things, of course, we'll be doing testing, guys. We'll be doing testing every day for HIV, STIs, or politically correct infectious diseases. And then we'll also be doing, physicals and things like that there. And then in addition to that, we'll be doing psychiatric evaluations, group and individual therapy, addiction counseling, neurofeedback, and medication management. There, our psychiatrist on staff, his name is Dr. Vijipura. You could find him. He's actually a board certified psychiatrist. Works for St. Joe's Hospital. So we're really buttoned up, guys. We're really here to help. We're ready to serve the community because we care like family.
Thank you for serving this community at such a high level. And I know that you are, you're a Christian man. I know that you are purpose-driven, and I'm just so excited to be able to platform you. Thanks for coming today.
No problem. Thank
Always
you so much,
pleasure.
Rochelle.
Always
you
a
are so
pleasure.
awesome. Like she's helped me so much in my business. She's helped me so much, giving me a platform. Rochelle really has a passion for helping the community. I've gone to a few of her events, and people just love her because she's really, really genuine. Your passion and what drives you with your sister and everything like that is just. You're just a model citizen, and I just wish more people would be like you. So thank you so much.
Thank you for those words. You inspire me. You inspire all of us. So you guys reach out and be sure to meet this rock star. All right. Bye, guys.